Hello, my name is Mariam Ahmed, and I am presenting research on the impact of the COVID-19 pandemic on the sexual and reproductive health of adolescents in Alberta. The COVID-19 pandemic has disrupted the normal life and routine of all individuals. Adolescents are at low risk for hospitalization and death from COVID-19. However, the pandemic affected other aspects of their physical, mental, and social health. Access to sexual and reproductive health, or SRH, services have been disrupted. In many places, health facilities have closed or have limited their services due to public health measures. To date, there are no studies to investigate the impact of the pandemic and related public health measures on adolescents' access to SRH services in Alberta. Through this research, we will explore the perspectives of adolescents and service providers on how the pandemic has influenced the SRH of adolescents and develop an adolescent-specific SRH information website that will help the adolescents to navigate SRH services, programs, and supports during and after the pandemic. Our intention with adolescent engagement in this project is to create opportunities for young people to be involved in the development of knowledge and strategies on issues that affect their lives. Moreover, we would like to increase adolescent involvement in healthcare decision-making, expand efficiencies in SRH care utilization, and ultimately improve SRH and overall health outcomes. The study was conducted in 2 phases. Phase 1 involved qualitative semi-structured interviews with youth and service providers. The study population consisted of adolescents aged 15 to 19 who wanted to or had access to SRH services in the past 5 years, as well as healthcare and community service providers who provided SRH care for adolescents in the past 5 years. Data analysis consisted of thematic analysis using in vivo. The study used an interpretive descriptive approach with integrated knowledge translation. To foster the co-creation of knowledge in the study and to enhance the integration of research findings, we established an Adolescent Advisory Group, or AAG, in Edmonton. The AAG were mentored and simultaneously participated in refining study methods and also contributed to the development of KT activities. In Phase 2 of the study, which is in progress, we will develop an adolescent-specific SRH website. The purpose of this knowledge translation activity is to have a virtual platform that connects adolescents to SRH services, resources, and supports. The website will be informed by the interview data and will be developed in partnership with the AAG.
The following research findings are from the adolescent interviews. They were thematically analyzed and thus resulted in 4 major themes. These themes are discussed with sub-themes in subsequent slides.
The COVID-19 pandemic has had a great impact on adolescents' SRH. The majority of adolescents who participated in the study reported not having normal experiences with their sexual and reproductive health as they did prior to COVID. As reported by some participants, they were at a stage of understanding sexual and reproductive health, but unfortunately there was limited and unreliable information due to the pandemic. Limited access to contraceptives, sanitary products, and services were also reported by participants to be a restriction in their SRH during lockdown, which was not the case prior to COVID. The study found both positive and negative responses to accessibility of SRH services during and post-COVID-19 pandemic restrictions. The challenges that were reported by participants included limited or no in-person visits to healthcare facilities, long wait times, and limited or no access to SRH-related procedures. Participants also felt like they had more privacy if they went in person to clinics than being at home with their family members. On the other hand, some participants shared that the pandemic has had a positive impact on their SRH during and post-COVID lockdown. Availability and accessibility to online services and telehealth was reported by some participants to be an opportunity to have accessible information regarding their SRH and to interact with qualified health professionals. The closure of schools due to the pandemic had an impact on adolescent SRH. Participants mentioned that schools were a primary source of SRH education for many adolescents. However, since schools had closed, this created a gap in SRH knowledge. When accessing SRH information from other means, such as websites, participants stated that they did not know which website to access for trustworthy and accurate information. Participants identified strategies that would make SRH more attractive to the adolescent population. Participants highlighted the need for SRH to be accessible and trustworthy. Strategies outlined include having adolescent-friendly information in areas that adolescents frequent, less complex website, welcoming and less stigmatized SRH service delivery, and removing barriers to access SRH services. The idea of a website or an app was suggested by many participants. However, participants stated that the app or website must provide them with local services, provide them a way to access these services with little to no barriers, and be easy to navigate. This research will contribute to the knowledge development about the impacts of the COVID-19 pandemic-related public health measures on the SRH of adolescents in Alberta. This will inform current and future adolescent SRH services and programs. Further, the SRH website has high potential to rapidly address unmet SRH needs, preventing the devastating consequences of gaps in SRH care for adolescents and improve health for adolescents across Alberta.